Hi, I'm Brian Anderson. I'm a PhD student studying medical physics at the MD Anderson Cancer Center, and my PhD research is on improving the treatment of colorectal liver metastases. So, colorectal liver metastases are colorectal cancers which have traveled through the body and gone to the liver. Now, about 8% of the new cancer cases in the US each year are colorectal cancers, and about 50% of these patients will develop colorectal liver metastases at some point during their treatment. So my PhD work is improving the treatment of these through the use of anatomical modeling. And before I go too far, what I want to explain is what this actually looks like. So in order to identify colorectal liver metastases, we usually get these nice contrast-enhanced CT images. So what exactly a CT image is it's just an axial slice of your own anatomy. Now here you can see on the left-hand side, we have the liver and then your ribs and spinal cord to kind of orient you with where we are. On your robot man, it's about here. In contrast enhanced, it means before we take the CT, we inject contrast, which allows you to get this nice contrast difference in the liver. Really brights up and makes it easy to see. And you see this red spot here that kind of shows up like a light bulb. That's the disease. Now it's really easy to find here, but that's about where the easy part ends. One of the treatment options for this colorectal liver metastases is ablation therapy. So essentially what this is taking a needle and injecting it directly into the liver, into the lesion site for treatment. There's some difficulties with this though, because while we get these nice contrast-enhanced images at the beginning, once you've injected the needle in during the procedure, you can't repeatedly put this contrast in to make sure you're in the right spot. Now I know you might be thinking, well, you know where it is beforehand, how hard can it be to hit it? But the thing is, your liver, if you think about it, right underneath your lungs, every time you breathe in or breathe out, that liver is moving, and it's a very squishy organ. So the nice thing about our anatomical model is we're able to make a 3D representation of the liver and say, okay, we know where the disease was beforehand. Once you inject the liver with this needle, we know how the liver moves and deforms to this, so we can ensure that the needle is going to the right spot. Especially in a place where your disease is only a couple of centimeters big, if you're off by even a little bit, you can completely miss the target. So we have retrospectively obtained 30 patients to date and have shown that of the 14 patients which had local recurrence, had they used this model, they could have identified with statistically significant difference that they need to go back and treat more. And we're hoping to implement this in the clinic soon and continue on with my research. Thank you.